Hello everyone, this is Dr. Devin Miles. Good morning. Hope you guys are prepared for this storm that is coming our way soon along the Gulf. Today we're going to talk a little bit about natural remedies for pain. And we're specifically going to discuss joint pain, headaches, and stomach pain. So these can be all different, or they can in fact be all related. It just depends on the different conditions that you may be dealing with. And so we're going to talk about how they can be related as well. So for joints, of course, a lot of people have joint pain. Sometimes there's nothing else that is per se the issue, and we tend to associate joint pain with age. To an extent, that is the case in the sense that over time there's a wear and tear on the body. May not be as resilient as it used to be. But a lot of that also has to do with how you take care of yourself. It's not just, oh, this is just going to happen, So I grew up playing very rigorous sports like basketball and soccer. I also ran track, played baseball, softball. I did gymnastics. Gymnastics was actually my first sport. And then a couple little spurts of swimming and tennis. That was more so like really, really short though. My main ones were like basketball and track. And I would say third was soccer. So I did a lot when I was younger, and I still like to do a lot. I still like to run, and for me, joint support has been important as I've aged. So even though I may look fit, there are still things that may come up for me. And now that I'm in my 30s, I'm paying even more attention than I needed to before. Even at a minimum, one of the big things that you can do to help support your joints is to stretch before you work out. And as I was in my probably late 20s, early 30s, I had to learn that because I wasn't stretching before I worked out all the time. Sometimes I would just wake up and just go for a run, and I didn't need to stretch. But as I got older, I needed to stretch. So that would be the first thing that I would say. Second thing in terms of your joints would be to hydrate. That may sound like, what does that have to do with my joints? But every cell of your body needs hydration to function properly, and your joints are no different from that. So just make sure, it's almost kind of like, greasing a joint. I kind of liken it to, when you grease a doorknob or something and then it works better. That's kind of what it feels like when if I've had joint issues that I improved through hydration, that's what it felt like I was doing. I was just making things much more mobile for my body. So now we're going to get into a few things that you can take also to help with your joints. So the first one is turmeric. So most people have probably heard about turmeric, but just want to go through it again. So that would be, turmeric is an anti-inflammatory, so it helps to reduce inflammation. It's also an antioxidant. And so what we mean by antioxidant is that there are free radicals being produced by your body. We have more of an accumulation of free radicals in certain situations just because our environment is a lot more toxic than it used to be. We're taking in more things into our bodies, and that can create free radicals. And so when you have free radicals in your body, that can lead to oxidative damage to the cells of your body. And so antioxidants help to combat that. There is a relationship between inflammation and oxidative damage. They can feed each other. And so what's nice about turmeric, and a lot of other herbs for that matter, is that they help to both reduce inflammation and improve your antioxidant status. And when I say that, that means reduce inflammation and reduce oxidative damage to your cells. And then also turmeric helps to modulate your immune system. So when it comes to the joints, all of this is extremely important because sometimes our joints are hurting because they're inflamed or there's inflammation going on in the body. And for you, it might be also reaching your joints. So sometimes turmeric can be really helpful for joint pain for that reason, because it's helping to reduce the inflammation. And particularly, turmeric helps to reduce connective tissue inflammation. So 30 milligrams 3 times a day has been shown to be comparable to the non-steroidal anti-inflammatory drug called diclofenac. So it can help to reduce what's considered COX activity in the synovial fluid of joints in patients with osteoarthritis. So when I talk about COX activity, again, that's a little bit more lingo in terms of inflammation. And so notice that I said 3 times a day. So sometimes when people take turmeric, I think they're only they're doing it on their own and they're just taking 1 or 2 a day and thinking that's going to make a difference. For me, when I have used turmeric and I was really trying to make an impact on inflammation, I was taking it 3 times a day. And I wasn't just taking any turmeric, because not every turmeric works for me. Even certain high quality ones have not worked for me. I have found a product, I was taking it 3 times a day, and it was turmeric, and they formulated a certain way to increase its bioavailability and its absorption. And that works really, really well for me. I've also used it on another client that I've had that has had chronic pain from venous insufficiency. And she is one of my clients where the pain takes more effort to make go away. But through everything that we've been doing, including this particular turmeric product, she has noticed a significant decrease in the pain. And that's not even joint pain, right? But again, turmeric is not specific like that to joint pain. It can cover all types of pain. So the second one would be boswellia. And if you're interested in that turmeric product, please consider scheduling an appointment because it's not just about the product, it's also about everything else that I would do for you. Again, even with my client, there were other things that I did besides turmeric. Turmeric alone wasn't going to fix all her problems, so just keep that in mind. So boswellia, which is also known as frankincense, it helps to deter the formation of leukotrienes. And so leukotrienes is another set of molecules that are contributors to inflammation. So this is actually in a lot of joint support products that use herbs. I see boswellia a lot. So it's pretty popular. I also used it at one point on kind of in my chest rib cage area. I was having some inflammation, and that helped really well. At the time, I did go to a chiropractor, and I was already using just straight frankincense oil, and I put it in a carrier oil. You could use coconut oil or avocado oil, jojoba oil. You can put a little drop of frankincense oil in that, and then just rub it on, your knee or your rib cage, wherever you need it. And that was very, very helpful. And so when I went to the chiropractor, she gave me these little packets, kind of like Icy Hot or Mineral Ice, the type of gel that gives you that hot and cold alternating feeling. And so when I looked on the back of it, it also had boswellia in it. So it is a pretty popular herb for using in terms of joint pain. So ginger would be another one. And ginger has shown in some studies to be as effective as ibuprofen. So ibuprofen is the generic name for Advil, or I should say the brand name for ibuprofen that most people know about is Advil. So it was shown in some studies to be as effective as ibuprofen for reducing discomfort related to arthritis stemming from inflammation. So there's different types of arthritis. So psoriatic arthritis, rheumatoid arthritis, these are more autoimmune-based forms of arthritis, and autoimmune disease definitely tends to come with some source of inflammation. It is the immune system attacking itself. And so when you can help reduce inflammation, you can also help to reduce that cascade of the immune system constantly attacking itself. Omega-3s are another one that are anti-inflammatory, about 26,000 EFAs, essential fatty acids, of a good quality fish oil can help to maintain prostaglandins. So prostaglandins, again, are another molecule associated with inflammation. So we've talked about, what was the first one? We talked about COX activity, that's COX, leukotrienes, and prostaglandins. And so even though I'm saying some of these big words, I think it's helpful for people to know. As I mentioned in another video that I did a while back, it might get harder for you to understand what an herb or a nutrient does in the future, because a lot of times you want to associate, okay, this herb helps with this disease. Well, the FDA is cracking down on anyone who is saying that any particular natural substance treats COVID. What the plan may be for the FDA to do in the future is to do that same thing with any disease. So if you're looking for herbs that treat lupus, you may have a harder time finding that. So it can be important for you to understand the science of the condition that you're dealing with. So when I talk about inflammation, well, let me backtrack and say, if you understand the functions of what's going on with the condition that you're dealing with, you might be in a better place. So for instance, if you have, diabetes, for instance, that is associated with high blood sugar, insulin sensitivity, insulin signaling is off. There's inflammation in the system. The beta cells of the pancreas are not working as properly as they should. All of these things that are going on within the body of someone who has the disease named diabetes, these would be good things for you to understand, because that's how you can better do research for herbs that help with those functions versus herbs or natural substances that help with a certain disease name. So even though I look at inflammation more as kind of a function or something that can happen in the body, not a disease name, inflammation is one of the functions that it's harder for people to find products that will list now that they help to reduce inflammation. I've seen it happen already in the past 10 years. The description labels that are on products are different than they were 10 years ago. So with inflammation, it can be helpful to understand when you're doing your own research what inflammation can look like. So inflammation can include certain molecules like prostaglandins, leukotrienes, or interleukin-1, which is IL-1, interleukin-6, which is IL-6. And so COX activity, again, that's another one that you can look at and see that that's synonymous with inflammation. So that can be helpful in terms of you understanding what to look for when you're looking for help for yourself in a natural way. So moving on, hyaluronic acid is helpful for most people. Some women probably know about this for your skin. It's in a lot of skin products. Helps in terms of like anti-aging, and it's good for skin plumping. But it also gives synovial fluid its viscous properties, and that helps to preserve joint flexibility, as well as elasticity and hydration. So one of the things that I want to also mention while I'm going through this list is the idea that you need to keep moving. So sometimes people start to have joint pain because they're not moving, and then they start moving and they have pain because the joints haven't been utilized as much. So there is a lot of value to just movement itself. There have been times where I've had different pains in joints, and a physical therapist will kind of sometimes make you feel like you shouldn't move. And to a large extent, that is correct. So I'm not taking away from what they're saying. But then there's other times when something is a little bit more, it's more minor. And if you actually continue to work through that while still doing other things to build back up the support of that joint, you can start to see an improvement in that area. So for instance, one point I had a chronic ankle pain, and it was associated with muscle tightness and muscle weakness. And so for a very long time, I was not moving as much as I wanted to. And it just took a new great friend in my life who had been used to just pounding through any type of pain he had. We were on different ends of the spectrum on that. But he encouraged me to just move, just still try to move through it anyway. And I was pleasantly surprised to see that worked. Again, what I had was minor, but it still kept me from doing a lot of the things that I wanted to do. And so just keep that in mind, that as you continue to get older, as time goes on, and we're in these jobs where we're sitting all day and all of that, at the end of the day, if you want to keep your joints healthy, you got to keep moving. So just keep that in mind, even though we're going through this list as well. So glucosamine is another one. It's a nutritional building block for connective tissue, and it's necessary for producing hyaluronic acid as well as chondroitin sulfate. You tend to see glucosamine and chondroitin sulfate in products together. And so these help to support joint comfort and improve mobility. So MSM is also another product. It's a source of sulfur, actually, and it's a component that is used to make collagen. So now we'll go into collagen. Collagen type 2 it's one of the main proteins that's in cartilage. So one of the things that I would like to say is that if you start noticing joint pain and it's getting worse and it's getting worse, don't sit with that pain. Go to the doctor, get imaging done. Because a lot of times when people get imaging done, they wait until it's bad, and then they find out that there's no cartilage left anymore, and you're bone on bone. It shouldn't, I know more than likely you've had pain before you got to that point, and you've probably had pain for a while. And again, this is what I'm saying, is that you don't have to live with joint pain. It's not something that I would consider per se normal to have on a regular basis. And so if you're getting surprised by something like that, I would just encourage, or you've seen someone who's gotten surprised in that way, I would encourage you to still get your joints checked if you're starting to notice pain, and have the doctor specifically look at your cartilage, see where it is. Because if there is let's say there has been some reduction in cartilage, but there's still cartilage left, then that means you have a lot more options to work with in terms of helping to rebuild that cartilage and help rebuild better support for that joint. Once the cartilage is gone, the options get less, and so doctors may start talking to you about knee replacements or hip replacements or things like that. Before you get to that point, go get your joints imaged and specifically say, hey, I'm wanting to see where my cartilage is. I want to see, do I still have something to work with here, right? So, because I don't see why people I don't think it should ever get to that point where you are surprised by a loss of cartilage on an MRI if you've had pain for a long time. So be proactive about it if you're experiencing pain that's just ongoing like that. Okay, so the last one in the joint category is arnica. So arnica helps to relieve muscle pain. This is an herb, as well as can be found as a homeopathic. So it can be in creams and different pellets. And so it helps to relieve muscle pain and stiffness, swelling from injuries, and discoloration. So it's actually really great for after surgery in terms of healing up areas that, of course, there was surgery on. So again, particularly with surgery, there's a lot of bruising that happens afterwards, especially if you're working on something like a knee or a hip. And so arnica can be really great for that as well. So on to headaches. So headaches can come for different reasons, of course. There's all different types of headaches. So we're just going to keep it kind of in the basic category. So the number one thing before we get into anything else is again, hydration. Headaches can, in fact, come from dehydration. And so when you're just working all day or you're on the move, and I've seen this a lot even just with my friends. They'll just have a headache, and I'm saying the first thing I ask is, did you drink water? And sometimes the answer is no. And so before you think, oh, I need to get something to eat, the number one thing you need to ask yourself is, how much water have you drunk today? And if it's not that much, then definitely start drinking a lot of water first. if it's a hot summer day, you may need more than water. I'll tell you that now. If you live in a place like where I went to medical school, which is Arizona, and it's July, then reverse osmosis water it may not work for you. It didn't work for me. I needed a lot more than just reverse osmosis water. Reverse osmosis water is very deficient in minerals, and the minerals are needed just as much as the H2O, if you will, to help actually hydrate your body, hydrate your cells. And so one of the things that you can do is put mineral drops in your water. If you need help with that, consider scheduling an appointment, because we can talk about that more in depth. But you can get mineral drops, as well as eat more fruit, because fruit naturally has all of this contained within it. It has the H2O plus various minerals that help to hydrate you really well. And so watermelon, for instance, is great for that reason, because most fruits have, water and fiber and minerals, but watermelon in particular is extremely high in water as well. So watermelon can be great for summertime, and just overall rehydrating your body. And that's also kind of why with hydration drinks, you see it's more than just water. They're putting minerals into that water as well. So the next thing would be magnesium. Magnesium helps to work with muscle contractility, nerve signal transmission, vasodilation, so it helps to dilate your blood vessels. And for that reason also, it helps to support blood pressure, regulate blood pressure. So this can be helpful for tension and cluster headaches, as well as migraines. Magnesium, if you're going to use it, be sure to look on the back of the label when you're trying to see which one you want to purchase, and get one that's either magnesium citrate, magnesium malate, or magnesium glycinate, not magnesium oxide. Magnesium oxide helps a person go to the bathroom when they're constipated. It doesn't absorb well, and that is the point of using magnesium oxide for something like constipation. But you want a magnesium that's more absorbable when it comes to trying to use it for headaches. Now, magnesium citrate, I would also say, is one that will help you go to the bathroom as well. So I'm not talking about the liquid magnesium citrate in the drugstores. That is designed to make you go to the bathroom. I'm talking about a much smaller dose of that, probably in pill form or powder form. So migraines, let's talk a little bit about migraines. One of the big things that you have to consider is food sensitivities. So some common ones would be wheat or gluten, dairy, citrus, chocolate, hard cheeses, as well as food preservatives. So recently I did a talk on artificial food coloring. And so things like that, and even beyond that, there's different ingredients in packaged foods that are preservatives, they're food additives, and these can cause problems for people, including create symptoms or promote symptoms like migraines. And so trying to eat as clean as you can and avoid food sensitivities can be really, really helpful for migraines. At one point, I was having significant headaches. Now I realize it was because I was exposed to a toxic air conditioning unit, as well as mold. And it was creating these really bad headaches that weren't considered migraines, but I decided to go ahead and address it like a migraine. And so I was very careful in terms of what I was eating at the time, and that made a difference. Of course, once I got away from that air conditioning unit and I got away from the mold, it took my body a while, but it eventually got back to a place where I wasn't having those headaches anymore. So in addition to food sensitivities and getting away from mold, getting away from AC units or heater units that create allergies for you, that is also just considered, all of these things are important for migraines. And then reducing inflammation, as I said before, because migraines, when we're talking about food sensitivities, we're talking about something that can create inflammation within the body. And so, as I mentioned before, with joint pain, if you have inflammation in the body and the joints are perhaps a weaker link for you, then that inflammation can stem over to the joints. If there's a weaker link that makes you, or a genetic predisposition, I should say, that makes you more prone to migraines, well then if you eat something that is causing inflammation for your system, then you are more likely to have a migraine. So even though migraines can be hormonal, that does not mean that what you put in your system is not part of that. Sometimes the hormonal component of migraines also has to do with your digestive system, because the digestive system and the hormonal system, they can be very much related. And so when I work with females particularly who are having digestive issues and hormonal issues, I work on both of them at the same time because I understand that they can affect each other actually. So also feverfew would be another herb to consider when you're thinking about migraines. And so just keep that in mind, that migraines is more than just taking this one herb. There are reasons you're experiencing that on a regular basis. And so it's more of a comprehensive strategy that I would encourage you to look at if migraines are part of the issue. And then in addition, headaches are just, sometimes they're coming from a lot of stress. And so when you are sitting like this at the computer all day, you're putting a lot of tension in these areas. And so that's why you hear about ergonomics all the time, where people are instructing you to sit up straight like this when you're at the computer. Or even if you do feel yourself doing this, take time to come back up, because it can really make a difference. Because if you're in this all day long, that's a long time for your body to be in what's considered more of an abnormal position in terms of what is a healthier position for your body. So just keep that in mind. And then a massage therapist can also help with all of this. So the other thing that happened to me is that I had a lot of tension right back here. It was like everything was just extremely tight. And so that can be another thing that can really be helpful when you're trying to understand, what can I do to get these headaches to go away? If in fact it is more of a tension headache, pinpointing where you feel it the most and massaging that area can make a huge difference. For me, when that happened, taking a Zyrtec was really, really helpful, because some of it was having to do with allergies. And so even though I'm saying it could be tension from the way that you're positioned, it could be a number of things all at once. So if you're sitting this way and you're eating food sensitivities and it's springtime and you have seasonal allergies, you can create just a triple whammy of your muscles tightening in the back of your head, and then you start having these headaches. And so it's also important to look at the different factors that could be contributing to the headache. And that's something that I help my clients to do, is figure out where specifically their aggravating factors are coming from. Then lastly, stomach pain. So stomach pain, we're going to talk about mainly inflammation and gas. Inflammation can create pain within the stomach. So again, you have to also look at food sensitivities, as well as the different things that I mentioned earlier, like omega-3s, which help with inflammation in the digestive system. Peppermint can also be helpful for helping to reduce the smooth muscles of the digestive tract. So it can help to reduce spasms within the tract. And chamomile can also be helpful for that reason as well. And helps with gas. And so when you have, sometimes with digestive issues, particularly for like irritable bowel syndrome, you can have spasms within your colon. Spasms is not just synonymous with muscle spasms, with skeletal muscle spasms. When we're talking about, like this muscle, the bicep or your leg, we're mainly talking about skeletal muscle. But you have another set of muscles called smooth muscle. And smooth muscles are within the digestive tract as well. So helping to reduce any spasms that could be happening within the smooth muscles of your digestive tract can also help to reduce pain. Peppermint can be helpful not only to reduce the spasms, but also to reduce gas. And so, of course, if you have spasms, you might have more gas as well. So if you can reduce the spasm, the gas can move, right? So ginger, again, can be helpful for digestive pain, because it helps to keep everything moving along. Sometimes you may have pain because there's food that's stagnated, right? And so ginger can help to continue to help everything move along. It helps to move that gas out. Gas can be stagnant, and that gas can cause pain. So if you can move the gas along, the better off you be. But why are you creating gas in the first place, right? Why are you creating spasms in the first place? So one of the things that might be difficult for your body to do right now is digest your food. Some people have villi that are they look a little bit like this in their intestines. If they're stunted, then the digestive enzymes that normally get secreted in the small intestines may not be secreting themselves. Or you have low stomach acid. So digestive enzymes in the form of a supplement can also be helpful to help you digest your food better. When you digest your food better, that means it's not staying around as long in your system. If it doesn't stay around as long as your system, it's less likely to create gas by fermentation. So we also have to look at why you're creating gas in the first place, right? It's not just about always moving it. Why are you forming it? And then lastly, just paying more attention to the emotional component. Sometimes when we're always stressed out, we're always angry, we're always irritated, that can really have an effect on our digestive system. And then the digestive system can also make us more anxious, make us more irritable. So they feed each other. So as much as you can do things like yoga or just say, you know what, I'm not going to have a conversation with that person right now because it's going to irritate me. And then that can affect my digestive system. You have to sometimes have those conversations with yourself and think, what is going to be best for me and my stomach today? So anyway, I hope that was helpful. And what I will also say is that if you're having digestive issues, it can in fact affect the headaches. It can in fact affect the joints. And so that's why I decided to put all three of these together, because even though each one of them can have their own things that are helpful, they can all affect the digestive system can affect the headaches and the joints. So just keep that in mind, that if all of these things that I had mentioned for like joint pain specifically were not working, think about what you're eating and does that have an impact. If drinking enough water and having, consuming magnesium is not working, then also think about, okay, well, what am I eating that could be causing the problem? What happens if I just have some peppermint tea? What happens if I just have some, I just take some omega-3s and reduce the inflammation? And then if that works, then why is it that all of these migraine medications were not working, but this thing that I did to help reduce inflammation actually did work? The body is very much connected in that way. So thank you so much for watching. I hope that was helpful. My name is Dr. Devin Miles, and I help people with prevention, gastrointestinal disorders, and kidney disease. And you can schedule a telehealth appointment at drdevinmiles.com. Have a great day, guys.